There are steps you can take to reduce your risk of having a stroke, and nutrition plays a key role. Strokes are a serious and potentially life-threatening medical emergency. They occur when blood flow to the brain is interrupted or reduced, causing brain cells to die. According to the American Stroke Association, stroke is the fifth leading cause of death in the United States and a leading cause of disability. However, there are steps you can take to reduce your risk of having a stroke, and nutrition plays a key role. Here are some tips for stroke prevention through nutrition. Eat a diet rich in fruits and vegetables. Fruits and vegetables are packed with nutrients that are essential for a healthy body. They are also low in saturated fat, cholesterol, and sodium, which are all risk factors for stroke. Aim for at least 5 servings of fruits and vegetables each day. Choose whole grains over refined grains. Whole grains are rich in fiber, vitamins, and minerals, and have been linked to a reduced risk of stroke. Examples of whole grains include whole wheat bread, brown rice, and quinoa. Limit your intake of saturated and trans fats. Saturated and trans fats can raise your cholesterol levels and increase your risk of stroke. Try to limit your intake of foods that are high in these fats, such as red meat, butter, and fried foods. Choose lean sources of protein. Protein is an essential nutrient, but some sources are better for you than others. Choose lean sources of protein such as skinless poultry, fish, beans, and nuts. Reduce your intake of sodium. High sodium intake is a risk factor for stroke. Try to limit your intake of processed and packaged foods, and choose fresh foods whenever possible. Stay hydrated. Dehydration can increase your risk of stroke. Aim for at least 8 glasses of water per day, and more if you are exercising or in hot weather. Avoid or limit alcohol. Excessive alcohol intake is a risk factor for stroke. If you choose to drink alcohol, do so in moderation. This means up to 1 drink per day for women and up to 2 drinks per day for men. In addition to these tips, maintaining a healthy weight, being physically active, and not smoking are also important for stroke prevention. If you have a history of stroke in your family or other risk factors, it's important to talk to your doctor about what steps you can take to reduce your risk. By making small changes to your diet and lifestyle, you can significantly reduce your risk of stroke and other chronic diseases.